Having a heart problem can range from non-threatening palpitations to blocked arteries or leaky valves to full-blown heart failure. Heart failure is a term doctors use to describe a heart that won't pump blood properly. Regardless of the cause, many people who have heart failure will die within 5 years. It is a serious disease even under the best of care. Our medical correspondent, Dr. Gary Schifrin, says there is hope on the horizon, but much of it comes from the doctor you choose. Here's his report.
Just a few short months ago, Ted couldn't climb stairs. His grandchildren knew him as a sickly old man who could barely walk across a room.
My life was miserable. It was terrible.
Ted's heart was so weak it couldn't pump blood through his body, a condition cardiologists call heart failure. It doesn't mean his heart stops. It just means the pumping power is weaker than normal. People with heart failure who don't get the kind of treatment Ted is getting can die very soon.
Now I can do a lot of things. I can cut grass. I can trim bushes. I can play with the grandkids. I can swim with the grandkids.
We still don't know if Ted will outlive the statistical norm of 5 years, but we now know things will be better than they've been for a long time. Finally, his disease is being managed with proper diet, different medications, a mechanical pacemaker device, and close monitoring by his physician.
A lot of people, especially if they've not been accustomed to being sick, find this very overwhelming. And it can be quite difficult to manage the complex combination of medications and office visits and so on.
Heart failure is the fastest growing disease in our country, in large part because we've been so successful in other areas of cardiac care. Most patients with heart failure at one time had a different disease, heart attacks from arterial blockage or valve malfunctions. But with better care and high-tech interventions, they now survive long enough to develop heart failure.
Heart failure is a major healthcare issue in this country. About 5 million Americans suffer from heart failure. Every year we add another 500,000 people to this list. People who have less symptoms, mild heart failure patients, 2/3 of them die suddenly without any warning symptoms. And the rest of the people gradually deteriorate and die due to progression of heart failure.
Dr. Karan Munaswamy of Fort Lauderdale is among a growing number of South Florida cardiologists that have begun to treat heart failure more aggressively. One way they do this is to make sure their patients get 2 different disease-altering drugs. These drugs, called ACE inhibitors and beta blockers, can extend life and improve symptoms, such as fatigue. However, even though medications work well, there are serious problems with the drugs that cannot be solved by the doctor or the patient alone.
My average patient spends with heart failure, spends between $3,500 and $5,000 on medicines a year, and some of them spend as much as $7,000 a year just on medicines for heart failure. When you're on a limited budget and you have trying to live on $25,000 or $26,000 a year, that's a lot of money.
Worse than being on a fixed income and having to absorb the cost of beta blockers or ACE inhibitors is to never get a prescription for the drugs in the first place. It is vitally important that family doctors and general internists learn to use these medications, since they are the ones that treat the majority of heart failure patients, not cardiologists.
The job of the primary care doctor is to recognize heart failure and to initiate the appropriate therapy and to make the referral when necessary. And I think although some studies suggest that there may be a gap between knowledge and implementation of the knowledge, hopefully we'll continue to work to close that gap.
If heart failure patients don't get the medical therapy they need to extend their lives, imagine how out of reach it must seem to get what Ted Gattert got. His heart not only beat poorly, it was out of sync. First the left ventricle, then the right ventricle, as shown in this graphic. About 30% of heart failure patients have this electrical malfunction. So no matter how many drugs they take, their problem usually needs mechanical assistance as well.
Here the idea is that patients whose electrical system results in an impaired activation of the heart muscle, such that instead of the heart muscle activating uniformly, parts of the muscle activate ahead of other parts of the muscle, so that the heart doesn't beat synchronously and most efficiently as a pump. And it's been found that by putting a pacemaker in 2 different locations of the heart, we can resynchronize the heart's contraction and seemingly make it more efficient as a pump.
This implant, called a cardiac resynchronization pacemaker, has made Ted's heart beat more efficiently, bringing back the vitality he thought he lost.
The moment that InSync was turned on, the therapy became active, I felt better, and I felt better ever since.
No question the implant changed Ted's quality of life, but an even newer device will help Josephine Harris feel better and live longer. She has an implant too. That's pretty obvious to the people at the senior center where she volunteers, because she's become so active again. Her implant will resynchronize and shock her back to life should her heart stop beating for any reason. Sudden death, as it is called, is a common way that people die with heart failure. That's why this new combination device, resynchronization and defibrillation, is so exciting.
It's a great idea to put both the quality and the quantity of life into one device, which would improve the quality of life in terms of decreasing the heart failure symptoms and improve the survival by preventing the sudden death syndrome. And that's why this InSync defibrillator to me is a very appealing idea.
Despite new devices and good medications, patients diagnosed with heart failure must play an active role in their own treatment if they expect to get the best care. The first step is for them to pick a doctor that is up to date. If their doctor is not prescribing ACE inhibitors and beta blockers, chances are good that the doctor doesn't yet understand which treatments are working best for this disease.
You know, in some communities, they don't have a cardiologist, they don't have an internist, they have a general practitioner. I think that as you become more and more specialized, it's been shown that the higher the specialty, the better treatment of the heart failure, the better the results. There have been studies done, for example, comparing heart failure treatment internists versus cardiologists, and as you would expect, the cardiologists do a little better job.
Next, when the patient has the right doctor, he or she must follow orders, and it's not as easy as it sounds. There are half a dozen different medications to coordinate, a rigid diet, usually without salt, and the need for the patient to weigh themselves every day. That's because an increase in weight usually means fluid retention, a precursor for a trip to the hospital ER with fatigue and shortness of breath.
The frequency of hospitalization is a not so subtle marker of how well people are doing. In other words, in heart failure, what typically happened was that you'd put somebody on a drug, you'd tell them about their diet and so on, and they'd go out and not do quite what you wanted them to do. And when the studies were done on what provoked this particular hospital admission, it was something very simple. It might have been going out and having a salty meal, or it might have been running out of your medicines, or running out of one medicine and skipping it for a few days.
Finally, it can't be emphasized enough that patients with this condition and their families need to get educated, because heart failure is a complex, debilitating, and life-threatening disease. That means reading and asking questions. Learning how to treat heart failure may be the final frontier in our ability to keep on ticking just a little longer. With these devices and medications, we can extend people's lives and make their remaining years more active and comfortable. For Health Check Second Opinion in Lake Worth, I'm Dr. Gary Schifrin.